Hello, this is Dr. Donna Gurley, and today in PCOR we'll talk about the public health system in the United States. Initially, this presentation was prepared by CDC in 2013 as a training module for various stakeholders. I've modified it for my presentation today. After our time together, you will better understand the public health system and be able to describe the responsibilities of public health, the 3 core functions and 10 essential services of public health, and the role and responsibilities of the various levels of public health agencies. If we look at the definition of health, we see that it encompasses a broad range of conditions. Health requires physical, mental, spiritual, and social well-being. Ensuring conditions so that people can be healthy is the job of public health. And in order to ensure physical, mental, spiritual, and social well-being, public health requires that society works together collectively. This Public Health in America statement was developed in 1994 by the Public Health Steering Committee, composed of representatives from public health agencies like CDC and HRSA, and key national public health organizations like APHA. It provides a vision and mission for public health, as well as the context of what public health should be prepared to do and how public health services are delivered. The vision for public health is broad: healthy people in healthy communities. The mission is to promote physical, mental, and spiritual health and prevent disease, injury, and disability. Public Health in America, this Public Health in America statement also defines the purpose of public health, which includes preventing people from things like influenza, infectious diseases, protecting against environmental hazards like exposure to hazardous materials in the community, preventing injuries both in the workplace and in the community, promoting and encouraging healthy behaviors, which includes healthy food and an active lifestyle, responding to disasters and assisting communities in recovery efforts, and assuring the quality and accessibility of health services for everyone. Recently, a series of different public health threats emphasized the context of public health in the United States. These events required responses from more than one geographic area and more than one agency. For example, extreme snowfall occurred in the winter of 2016 along the eastern seaboard and caused disruption of everyday life for people living there. Also, another example, Zika and Ebola viruses spread to countries worldwide and would have had a much more devastating impact if it weren't for the vigilance of public health professionals. And in August 2016, the 6.2 earthquake that rocked Italy caused widespread damage, entrapment, and death for many people. As you can see from these examples, they are all different scenarios but had similar impacts on everyday life. All of these incidents would be considered disasters, but were caused by very different factors. One of the most severe natural disasters was Hurricane Katrina in 2005. It devastated 90,000 square miles of the Gulf Coast. You can read some of the statistics shown here and realize this was a very costly disaster. As climate change unfolds in our time, these severe weather events will likely increase and cause the greatest damage in areas where communities with few resources can rebound quickly. The more traditional view of public health has been on the top 10 causes of death in the United States. As you can see, heart disease and cancer are the top 2 killers or causes of death in the United States, and both of them kill over 500,000 people each year. However, both of these are considered lifestyle-related diseases. They're chronic lifestyle-related diseases. You can also see new to the top 10 are intentional injuries such as suicide, and those account for over 38,000 deaths each year. Many of these causes of death can be prevented by public health. Here's a question to think about. Have we made progress towards reducing or preventing these deaths? If so, how? Public health touches every individual every day. Addressing the cause of death and emergencies cannot be accomplished by one person at a time. It takes a group of people, and public health impacts multiple people every day rather than traditional medicine that has focused on patient care, one patient at a time. The average life expectancy in the United States is now 79 years. A little less for men and a little more for women. Over the past 100 years, life expectancy has increased by more than 30 years. Public health improvements are credited for 25 of those 30 years. Some achievements of public health, and you can see the list here. Safer workplaces, safer food, and safer drinking water are all part of environmental health, which is a subpart of public health. You can see other things such as motor vehicle safety, vaccinations, but these are all things that public health has implemented and has achieved to reduce incidents of injury and death, which then translates into an increased life expectancy. The foundation for public health lies within the three core functions: assessment, policy development, and assurance. The Public Health Steering Committee further developed these core functions in 1994 into the 10 essential public health services applied to and carried out at the various levels. Let's look at these more in detail. Ten essential services are shown here. They monitor health status to identify and solve community health problems, diagnose and investigate health problems and health hazards in the community, inform, educate, and empower people about health issues, mobilize community partnerships to identify and solve problems, health problems, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health and ensure safety, connect people to needed personal health services, and assure the provision of health care when otherwise unavailable. Assure a competent public health and healthcare workforce. Evaluate effectiveness, accessibility, and quality of personal and population health services. And finally, conduct research for innovative solutions to health problems. Those are the 10 essential services for public health, and it's important that you know what those are. Not that you memorize them, but that you can identify them. This diagram depicts the 10 essential services and how they relate to the three core functions. Public health in the United States is framed around three core functions of public health, which we talked about: assessment, policy development, and assurance, which are on the outside. Each core function is linked to essential services that a health department should be providing, either at the state or the local level. Under the core function of assessment are found surveillance and disease investigations. Under policy development are found education, partnership mobilization, and policies. Under assurance, the following essential services include enforcement of public health laws, linkage of citizens to needed care, developing the public health workforce, and evaluation. At the heart of the essential services and core functions are two keys without which public health cannot function. One is system management, and the other is research. So for the specific public health discipline that you are studying, can you identify where that discipline is found? It's likely located in several places. Next, let's take a look at the structure of public health services in the United States. So how does all of this fit together? Investments in the three core functions of public health, directed by a public health services and systems research agenda, lead to big dividends in public health outcomes. There are various levels of governmental agencies that implement public health services. They include state health departments, tribal health departments, specifically for Native Americans, local health departments, which are typically at the county and even city level, and territorial health departments for the U.S. territories, most of which are found in the Pacific region. Let's start with the public health system, the federal public health system. The federal public health agencies like CDC have large overarching responsibilities. You can read these, but I'll highlight two of them. Act when health threats may span more than one state, a region, or the entire nation. A good example of this would be an event that impacts more than one state, like Hurricane Katrina, which impacted both Mississippi and Louisiana, or an infectious disease outbreak that would affect multiple or impact multiple states. Another is act to assist states when they lack the expertise or resources to effectively respond in a public health emergency, such as a disaster, bioterrorism, or an emerging disease. The federal government provides a crucial role in looking at all of these different things, like providing leadership, goals, resources as far as finances, and then research. So they really look at the public health system at a much higher level. Next, let's look at state health departments and their roles and responsibilities. So states are charged with very different things than the federal agency or agencies for public health. For instance, they would be screening for diseases and conditions like HIV, TB, diabetes, newborn screening, treatment for specific diseases such as HIV and tuberculosis, technical assistance and training for emergency responders, hospital, policy development, local health departments, state laboratory services such as foodborne illness testing, influenza typing, environmental toxins, and epidemiology and surveillance. For instance, data collection on risk factors, communicable infectious diseases, vital statistics, and chronic diseases. So the state acts as a collection repository for data that comes throughout the state, from the counties typically. In 2011, you can see the state budget, state healthcare agency budget. The majority of the source of funds came from federal funds, almost 45%, followed by the state general funds, which was 22%. And for those of you who don't know, general funds are tax dollars, which really are depicted or developed by the economy. So if the economy is bad, there are less general fund monies to go around to all of the different things that are required to be implemented at the state level. You can see other sources of funding that are available to the state for their funding, for their services that they implement at the state level. Now let's look at local health departments and their roles and responsibilities. There are several ways to look at local health department functions. They are local or decentralized, and that means that the local health departments are led by the local governments, and they make fiscal decisions about how resources are allocated and spent. A mixed model includes local health departments that are led by a state government, and some are actually, the state governments are in charge of those systems, of those functions. A centralized function, which means that the local health departments are really part of the state government. They're not directed or operated by the individual counties, but they're operated by the states themselves. And then shared is another area of governance where all local health departments are governed by both state and local authorities. This map indicates which states are governed by which model. You can see in the green, which is the vast majority of the states, local control is made by the local health departments, and that is set in place by policy. And then you have a very small number that are state and then that are shared, and you can see those in the different colors depicted. How does your state or county how is that set up? Within the state of California, we have primarily a local system where local health departments are in charge of their fiscal resources, some of which they get from the state. Oftentimes they'll get monies, finances, which we'll talk more about in our financial management module, but they'll get monies from grants, from state general funds, and also from fees, typically from permit fees. But if you're from another country, how does public health, how is that dispersed within or distributed, modeled within your country? Is it a local method, a mixed, a state, or a shared model? These are the most frequent services and activities provided by local health departments in the United States. And you can see the percentage of local health departments that implement these types of services. There's a lot of environmental surveillance, such as food service establishment, food safety education, but then there's also infectious disease treatment and prevention, such as immunization, tuberculosis treatment. And there's also a lot of food nutrition safety, such as population-based nutrition services, and also ensuring that food is safe for the public. This is a national profile of local health departments and the percentage of annual revenues. So you can see that there is a little more than more than a quarter come from local revenue sources. But there is also a lot of money that comes from state and federal monies. Then there's also monies that come from other federal systems. But I wanted you to see the distribution of how a fund or funding mechanisms support a local health department. And you can see they are varied. There are a lot of different sources. Now let's look at local boards of health and their roles and responsibilities. A local board of health is a designated body whose role is to protect and promote health within its community. Most of these provide oversight to the local public health agency, and they are really, like it says, it's a local board of health, and it oversees the local health department. Sometimes it oversees more than one health department. There are 10 responsibilities that boards have the authority to perform, and you can see the functions listed here. Oftentimes, a local health department has certain things to do, but the board, which would oversee these activities, is usually in a leadership position, so they would review regulations, they would review data that's been collected, they would collaborate, they would ensure that risk assessments, health risk assessments have been conducted and completed. So they look at more of a big picture, higher level for the local health department. That's a board of health. The fiscal responsibilities, can we delete that slide since there was really nothing to go with it? So let's look at public health in the U.S. Insular Areas. These are territories and freely associated states. And remember, I said most of them are located in the Pacific region, but there are some in other areas as well. There are 5 U.S. territories, and you can see them listed here: Puerto Rico, Guam, U.S. Virgin Islands, American Samoa, and the Commonwealth of the Northern Mariana Islands. There are 3 freely associated states, and they have a compact of free association with the United States. And you can see them listed here: the Republic of Marshall Islands, the Federated States of Micronesia, and the Republic of Palau. So in geography, these insular areas are typically isolated and remote, with small islands, widely dispersed populations. They also pose a challenge because they're not immediately adjacent or accessible to the United States. So oftentimes having these programs spread out among such a wide area with a small population and a lot of little islands, so oftentimes it dilutes their impact. But often as well, we need to look at a difference in culture, a difference in economy, a difference in education, both in access to education and also the level of education, oftentimes is limited. They also, these populations suffer from different types of diseases, even though they are becoming more and more like the United States in that oftentimes they're lifestyle-related diseases. The peoples of these insular areas still suffer and die from chronic. These people often suffer and die from infectious diseases. So that's something to keep in mind. Insular areas are isolated, they're remote areas, and they have different challenges from the rest of the United States population. So we can't just develop a program here and expect it to be applicable to these areas. They need specific types of education, specific types of assessment to see what is needed for their populations. So how can federal public health agencies address public health needs for insular public health areas? Number one is to work with the leadership there to better tailor assistance to meet their needs. The second is work within and between agencies to better coordinate public health support. And this is through stakeholders and other groups that may either be there or have a stake in what happens in that specific area, such as the World Health Organization. And then place more federal personnel in these regions. Because the need is so great and is so different, people need to be there rather than administering programs from a remote off-site location. And then additionally, how do we explore and pilot initiatives that are better suited for these small jurisdictions with limited resources? So some of the things that are listed here, implementing programs and coordinating them, is more easier and practical in smaller locations than a wide geographic diverse area. Also, collaboration is great through groups like the Pacific Island Public Health Officers Association. Peer-to-peer practice, peer-to-peer sharing of best practices can be more beneficial when it occurs between peers who are in similar situations and face similar challenges. And then grants and program management capacity is often a big problem in insular areas. They often have much more limited capacity and competency in the area of business services and management. Now, let's look at Native Americans and how public health is organized for these indigenous groups. There are organizations defined and recognized as tribal health departments, but then there's a broader set of organizations or entities that provide services in a tribal setting. First is a tribal health department, which is a health department or a corporation or an organization that operates under the jurisdiction of a federally recognized tribe or association of federally recognized tribes. And it's funded by the tribe or through a contract from Indian Health Service. The second is a tribal health organization, and these include tribal health departments, Indian Health Service units, area Indian Health Service boards, and urban Indian health centers. So these two work together to ensure that the health of Native Americans, their health services are actually met. Government is not alone in developing, designing, or delivering public health. It takes a village. Now let's look at non-governmental organizations that support our governments at all levels to implement public health. Many different types of organizations participate to improve health within our communities, and our goal is a system of partnerships that interact collaboratively and effectively with all levels of governmental public health and with each other. You can see in this graphic there are a variety of stakeholders that are non-governmental partners. They can be things such as church or faith-based organizations, schools, environmental health organizations, transportation, law and justice, community services. The list goes on because public health touches so many different things of our lives. We need to look at non-traditional stakeholders and partner with them to make sure that public health is implemented for all of our communities. This is another way to depict how non-governmental organizations collaborate with governmental agencies to ensure health for all. Each of these organizations plays a role in working to improve the public's health. And you can see there are many, from doctors, hospitals, civic groups, laboratories, faith-based institutions, behavioral health, community centers, transit, elected officials. Public health, as I said earlier, touches so many different areas of our lives. We need to reach out to non-traditional partners to see how can we collaborate and turn the dial and change health for all of our constituents. Collaboration happens at all levels to deliver and ensure health, and these include partnerships, effective communication, overarching health objectives, sharing resources rather than competing for them, leadership provided typically by governmental agencies, and feedback from all partners involved. Now, I hope you can see that public health is a very diverse, interconnected network of partnerships that can work together to ensure the health of everyone. Thanks for watching.